implantation, new valves, aortic valve prosthesis, mitral valve prosthesis. And if you have a patient who has got a new valve, prosthetic valve, especially if it's a metallic prosthetic valve, you're presenting with shortness of breath, syncope, think of obstructed prosthetic valve. I remember many patients, not just one patient, many patients who present with this fatal or near fatal complication. I've seen young boy as young as 12 in Saudi Arabia who presented with obstructed prosthetic valve because the patient was not taking, being a young boy, was not taking warfarin, and his INR was so low that patient presented with obstructed prosthetic valve, no forward flow, thrombus there in the valve, no forward flow, so obviously you're going to lose consciousness, shortness of breath and consciousness. I've seen it here in Lahore, a person who was working in a manual labor, working in the factory. He had aortic valve prosthesis put in. Again, he was not regular with his warfarin and presented with severe obstructed prosthetic valve, resulting in shortness of breath, almost cardiogenic shock. So the common prosthetic valve which leads to obstruction is mitral. Mitral, why? Because of the low pressure on the mitral side. The lower the pressure, the greater the chance of thromboembolism. So highest chances of thrombosis on the prosthetic valve are found on tricuspid because of the lowest pressure chamber. But tricuspid valve replacement is very rare. Hardly many people get it. Very few people will get it. So therefore, the largest number of obstructed prosthetic will be found in the tricuspid position, and after that is the mitral position, and the least will be found in the aortic valve. The least. You can even get away with a little anticoagulation because a very high pressure chamber, so therefore the chances of thromboembolism in the aortic valve prosthesis are relatively less as compared to the mitral and tricuspid. Right? Atrial myxoma, only in the books. I've not seen anyone. So only in the books you'll find the patient presents with syncope or may have syncope. They may have, but it's a rare diagnosis. It's found rarely, even in cardiology practice, and it's even more rare to find syncopeal attack in atrial myxoma. But just remember, because the books say, so it may be there. Pericardial tamponade, again very rare. The patient presenting with syncope, patient present with shortness of breath, swollen necks, fall in blood pressure, and cardiogenic shock rather than syncope. So the commonest cause, the commonest diagnosis that you're going to come across for syncope is vasovagal, especially in the ladies. 2, postural, particularly in the elderly patients who are on polypharmacy. And number 3, in elderly patients who are having Stokes-Adams attacks due to bradyarrhythmia. In young patients, you may have tachyarrhythmia, particularly in patients with underlying ischemic heart disease. So you have to look at those patients, do the ECG, send them over to the cardiology side. These are the common causes of syncope in the family practice. Cerebral causes, again, rare, but they can be found they can be associated with drop attacks, vertebrobasilar insufficiency. Just drop attacks, because this is the circle of Willis, and that circle of Willis basically supplies the brainstem. So brainstem dysfunction results in drop attacks. You just go down like a thud. So in cerebral disease, due to vertebrobasilar insufficiency. In carotid insufficiency, it has to be very severe and bilateral to produce drop attacks. So carotid insufficiency is not associated with syncopal attacks. It is vertebrobasilar insufficiency. Right, so recap, that syncope basically are not uncommon. In Pakistan, the commonest cause of young females or young patients is vasovagal. In elderly, it's postural, especially with polypharmacy, and again bradyarrhythmia in elderly patients with complete heart block or second degree, Mobitz 2, second degree heart block, tachyarrhythmia in appropriate patients such as ischemic heart disease or maybe pre-excitation syndrome such as WPW syndromes. Vertebrobasilar insufficiency is uncommon but one of the important causes in the cerebral dysfunction. Thank you very much for your attention, and any questions?